Good morning, everyone. The title of our program or workshop is called Integrating Health Literacy in Adult Education. During this workshop, we will focus on examining the importance of encouraging adults to practice healthy habits and make informed health-related decisions through adult education. This presentation is brought to you by Group G. Agenda. Here we have an agenda of how the workshop will be laid out for the day. Please take a moment to review each point and get familiar for what will be coming up. Introduction. The prevalence of chronic disease is high in the modern world. A significant number of adults have chronic health conditions such as diabetes and hypertension. Unhealthy living habits are a significant factor that increases these diseases' prevalence. Health literacy skills can be improved along marginalized groups by incorporating health-related topics into adult education courses. How the workshop will facilitate health literacy development. It will work on delivering of adult education to improve the health literacy. It will educate the adults on healthy habits to adopt, such as taking balanced diets and physical exercises. It will also educate people about unhealthy practices to avoid, such as smoking and excessive alcohol consumption. This will improve adults' health literacy, facilitating lifestyle changes by practicing healthy habits. First, we would like to go into the definition of health literacy. Health literacy can be defined in two different ways, partly because it's a combination of the vital things that one should be health literate about, such as healthcare, exercise, gym, online, or information from the media. Also, it's things that you possess about the subject matter. When looking, we will look at the definition of personal health literacy. This is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy is the degree that which an organization enables individuals to find, understand, and use information and services to talk about health-related decisions. Here we will have an informational video on health literacy that will be shown to our workshop individuals. This video includes a lot of information that will be helpful and informative for our trainees to watch. Next, we will go into the importance of health literacy to adult education. Why does education matter to health literacy? It is the link between health literacy and education. Education creates opportunities for better health. Poor health can put educational attainment at risk. Conditions throughout people's lives, beginning in early childhood, can affect both health and education. If you take a look at the upper right-hand corner, you will see a model that shows just how education and health and other contextual factors are all linked together. Our goals to educating adults on health literacy. Health literacy goals. Engage adult learners on health activities. Learning to use health materials to engage in health activities that promote healthy lifestyles and well-being for the individual. Adult education goals is to educate adult learners on literacy skills for all health issues. Navigate through information to obtain information on health issues. Access health services and management of health issues through literacy. Unexplored approaches and programs to support adult health education. 1. A video can be very helpful to illustrate healthy and unhealthy habits. You can show a simple video like we did before in previous slides, or other videos that have more personalized factors to show how an unhealthy person is living and how an unhealthy person is living. Also offering virtual health education. Healthcare professionals can offer health education to adults when they are in different geographical locations. This also makes it easier for individuals to have access to knowing to the right professionals to know the right healthy standards and habits to have. The educator's role and impact on health literacy and adult learning. 1. The educators can help develop students' capacity to participate in planning by seeking clarification and offering suggestions. 2. It helps students learn to locate information to guide their health-related decisions. 3. Enhances students' ability to complete forms, make and navigate new environments. Strengthens students' ability to reach charts and scales and interpret ranges. 4. Teach students to ask questions about tests and test procedures and results. 5. It teaches students how to read medicine labels, calculate amounts of timing, and doses. Here we want to talk about the critical thinking aspect of health literacy. Critical health thinking literacy is a higher order technique that may be created through education to critically evaluate information relevant to health, where health literacy is the capacity to obtain, interpret, evaluate, and use health information. There are 4 components of health literacy that will be talked about here. Cultural and conceptual knowledge. The term cultural generally refers to the common beliefs, understandings, and standards that people develop as members of society. In this way, they affect how people interact with the healthcare system and contribute to the assessment of the suitability of health literacy abilities in various contexts. Print health literacy, that is going to be our writing and reading skills. Oral health literacy, that would be our listening and speaking. Numeracy would be explains a person's capacity for comprehending clinical and public health information. Here we have a fun facts to show how we have 3 resources to use to improve health literacy. We have the Centers for Disease Control and Prevention, CDC, the Gateway to Health Communication and Social Marketing Practice, the Food and Drug Administration, FDA, Risk Communication, and NIH, National Cancer Institute, Health Communication and Informatics Research Branch. Activity 1, how healthy are you? In this activity, the individuals will have to answer a series of 6 questions. During these 6 questions, it will be vital for the individuals to pay attention to how they answer and how their partners answer. Research says that the key to teaching health literacy is to make it fun and engaging. Now that we've learned the definition of health literacy and some key concepts, it's time to participate in our first activity. Participants must stand shoulder to shoulder in a straight line. As the questions are asked, for every question that is a yes equals 1 step forward, and every answer that is a no equals a step back. The objective of this activity is to give participants an idea of their current level of personal health literacy. Those that have answered with more yes than no's will be further ahead of the starting line, and those that have answered no more than yes will be further behind the starting line. This will help to give a visual representation of where you stand when it comes to knowing about your own health moving forward, and the kinds of questions you can ask others to help their understanding and get the conversation going. For activity 2, we will play a game called Doctor and Patient. For this activity, the students will be put into groups of 2. One will be the doctor and the other will be the patient. The doctor will be the one conducting all of the testing on the patient. At the start of the activity, the patient will have to fill out a medication form. It could be real or made up. After that, the doctor will take the height and weight of their patient. The doctor will then ask the patient some important medical questions about their diet, exercise, and lifestyle habits. Once this is completed, the doctor will prescribe medicine to the patient, at which the patient must read out the dosage and instructions of that medication. There can also be some other steps added to this activity to make it more informational. This activity will help the students learn how to ask and answer important questions regarding their health. Since this is a partner activity, their communication skills will also be increased. These quick and easy tests/questions are important in everyday life, so this activity will help the students feel more comfortable with doing this on their own. In closing, we will do a summary of what the workshop was about. Adult education is a significant approach to improving health literacy. Health literacy improves people's understanding of their health conditions and how it can be improved. A workshop helps educate the adults about the healthy habits to adopt and unhealthy practices to avoid. Technology advancement and offering virtual health education are significant strategies that can be exploited to improve adult education. Thank you for listening to our workshop for Group G. Hope you enjoyed.